Okay, welcome back. I trust everybody has now watched the video Sick Around the World. If you didn't, go do it now. The rest of us will wait. The hell we will. Now, let's proceed. Okay, so you watched the video Sick Around the World, which showed 5 advanced capitalist democracies that all managed to provide universal health care for their people. Now, a notable similarity among all of these 5 countries is that they impose 3 rules, as noted in the video. They make insurance mandatory, so the government pays premiums for the poor. They allow no for-profit insurance companies so that everybody gets care. And doctors, hospitals, and pharmacies all have one standardized set of negotiated prices. I want to go through each of these countries one at a time briefly and talk about them. And as I do, think about how those rules apply and how those rules don't apply in the United States and how that has an impact. Okay, so the United Kingdom, socialized medicine, providing universal health care. So no bills, no bankruptcy. Doctors are salaried public employees. Hospitals are publicly owned. And the general practitioner, the GP, serves as a gatekeeper for referrals. They get bonuses for good patient outcomes, not for volume of care. As a general rule, the United Kingdom has excellent primary and emergency care, but they can have longer wait times for elective care. All right, Japan. Social insurance provides universal care. Doctors and hospitals are for profit, but the government negotiates standardized prices. Insurers are nonprofit. There's mandatory coverage through your employer or a community insurer. They have no gatekeepers, no wait times, high use of healthcare, excellent health statistics. Germany. Germany uses sickness funds to provide universal care. Doctors, hospitals, and drugs are for profit, but the insurers negotiate standardized prices. And the insurers, known as sickness funds, are nonprofit, paid through income-based premiums. Taiwan. Single-payer system provides universal health care. Everyone has a medical card with an ID, their history, their prescriptions. The administrative costs are nearly non-existent. It's like 2%. There's no gatekeepers, no referrals, no wait times, excellent health statistics. And finally, Switzerland, in which universal health care is provided through insurance, but the insurers are non-profit. There's mandatory coverage. Doctors, hospitals, and drugs are for profit, but insurers negotiate standardized prices. Now, consider these 5 systems. Which of them has socialized medicine? Hint, only one. Which of them has the lowest administrative costs? And which is best? More importantly, would you swap out the United States system for any of these? Before answering that question, we should probably take a look at how healthcare in the United States actually works. So just a little bit of background on the current system. In the US, we have the most expensive healthcare in the world right now, per person. It's paid for by a patchwork of private employer-based insurance, public insurance programs like Medicare and Medicaid, the VA, the Bureau of Indian Affairs, the Bureau of Prisons, and out-of-pocket costs. Our costs are the most expensive in the world and rising. We pay almost 1/5 of the US economy on healthcare. A couple examples of this that make us really stand out as a nation, and not in a good way. 2 pieces of research. The first by Gilligan and colleagues in 2018 was an article called Death or Debt: National Estimates of Financial Toxicity in Persons with Newly Diagnosed Cancer. You may have heard news reports of this story, which effectively said that 42% of all new cancer patients lose their entire life savings within 2 years of their initial diagnosis because of treatment costs. Entire life savings, 2 years down the tube because of treatment costs. 62% of all cancer patients are in debt. Most of these people had insurance. A second study from last year by Herkert and colleagues, cost-related insulin underuse among patients with diabetes. Over the past decade, Insulin prices have tripled in the United States, and out-of-pocket costs per prescription have doubled. We're seeing an increasing number of people engaging in what's called self-rationing. More than 25% of diabetics who are surveyed say that they have skipped or cut down their insulin doses because of the price. They simply couldn't afford it. Now, that can be debilitating or it can be outright fatal. Note that an insulin pen that costs less than $15 in Germany or Canada costs $140 in the United States. In terms of accessibility, between 28 and 30 million people in the United States still aren't covered at all, even after the institution of the Affordable Care Act. That's about 8 to 9% of the population, including 13% of adults and 5% of children. The United States ranks last among developed nations in terms of healthcare access and fairness. We get less bang for the healthcare buck than just about any other country in the world does. And there's increasing pressure to fix this once and for all. Here's one way to do it. It's called Medicare for All, but it actually goes significantly beyond what we currently have for Medicare. Medicare for All, or M for A, would replace the current system of private insurance, Medicare, Medicaid, the Affordable Care Act, the VA, all of that. It would toss all of that right out and replace it with a national health insurance system that covers everybody from cradle to grave for all medically necessary services. Possible exception to that would be medically unnecessary services like cosmetic surgery, but it would cover sick care, surgical care, wellness care, mental health care, dental care, vision care, long-term care for the elderly. All of that would be included. Under Medicare for All, in fact, under any universal single-payer system, the government negotiates prices for healthcare services, for medical equipment, for drugs, for pretty much everything. The government sets payment rates for all of that. And the healthcare providers, hospitals, prescription drug manufacturers, just send the bill to the government instead of to a private for-profit insurance company. Nothing really changes from the standpoint of the healthcare provider, except the address that they're sending the bill to and the amount of paperwork involved. There is significantly less paperwork involved in a universal single-payer system because every person is going through the same system. You don't have a multiplicity of different insurance companies with different billing rates and different rules. The idea of Medicare for All specifically has been suggested as a plan that would phase in over 3 or 4 years. So we'd start, right now, people over the age of 65 get Medicare. We would lower that to, say, the age of 55, and then gradually to the age of 45. And within 3 or 4 years, everybody would have access. So here's the problem that comes up most, the most common objection. It's sticker shock, in the sense that this would be incredibly expensive. And not going to lie, it definitely would. The expectation is that Medicare for All would cost $32 trillion over 10 years. That's trillion with a TR. That's the big number. However, we're currently paying approximately $45 trillion over 10 years under the current system. So the objection that it's so expensive we can't possibly afford it doesn't take into account the fact that our current system is even more expensive, and that every other developed nation and many developing ones are managing to provide universal care much more cheaply than we're providing our current system of care. The cost would be huge to transition to this system. After we made that transition, it would end up costing us far less than we currently pay. The plan would be to pay for it with progressive taxation, the same way we pay for other universal care systems like the police, the fire, military, schools, parks, roadways, and so on. At the individual level, at the point of service, there would be no cost at all. In other words, when you saw your doctor or went to the hospital or received any kind of medical care, you would not be paying a copay You would not have deductibles. You would not have insurance premiums. You would simply hand over your card, and whoever was providing you with the care would bill the single-payer system for it. This would eliminate an immense amount of billing costs and administrative overhead. As a matter of fact, it would eliminate the insurance industry overall. One of the arguments that's been made against Medicare for All by some people is that you're going to be putting a lot of people out of work in the insurance industry. So the plans that have been suggested most recently would involve taking about 1% of the current healthcare budget and using it to assist people who have been dislocated because their jobs have disappeared. Overall, it ends up costing less for everyone, including people who have to be relocated into different jobs. This is a plan that was brought to national attention by Bernie Sanders when he ran for president in 2016. He sort of brought it to the national stage. Here's the question. Could Medicare for All become the law of the land in the United States? Here's why it's problematic. This has been actually introduced in every session of Congress since 2003, so almost 20 years now. We keep introducing it in every session of Congress, and it goes nowhere because the bill has to be reintroduced in each session. After there's an election, the bill has to be reintroduced in Congress, separately in the House and the Senate. And if both of those houses pass a version, then those two versions have to be reconciled in a committee. It's a huge bureaucratic nightmare to get pretty much anything passed. What matters here is that this means it really requires pretty broad bipartisan support to make something like Medicare for All happen. And that's a problem. On the one hand, Democrats vary in their level of support for this. The support for Medicare for All is coming almost exclusively from the Democratic side. People like Bernie Sanders, Elizabeth Warren, Alexandria Ocasio-Cortez, all of them support Medicare for All. A number of other Democrats, including Joe Biden, support a public option, which would be kind of a weaker version of Medicare for All that lets people buy into Medicare at younger ages, but keeps private insurance for most of us. So the Democrats vary in their level of support for Medicare for All, but most of them are pretty on board with the basic principle that healthcare should be considered a human right. Republicans are not. Republicans see healthcare as something that people should pay for, and if they can't afford it, well, there should be a different level of care. Republicans unanimously reject the principle of universal health care. They see it as socialism. Currently, Republicans control the White House and the Senate, and that means that it is not possible to pass something like this. However, that could change in November. There is increasing pressure right now to shift to a single-payer or a socialized medicine system. 2/3 of U.S. Americans support single-payer in principle, although there's a lot of disagreement and a lot of confusion about what exactly it would be. However, again, 2/3 of people support single-payer, so do a growing proportion of doctors. And in the face of the coronavirus pandemic, which is causing massive economic disruptions and spiking unemployment rates right now, many people are waking up to the fact that in the age of a pandemic, a healthcare system that ties your care to your job might be a bad idea. So what about you? What do you think? Do you think we should institute some kind of universal healthcare system? Do you think we should tweak what we currently have? Do you have a completely different idea altogether that you think would make more sense? Let me know in the commentary. Okay, talk to you soon.